Color blindness, also known as color vision deficiency, is a condition where a person finds it difficult to distinguish between certain colors. Most commonly, this affects the ability to see red, green, or blue hues clearly. While many people may not even realize they have this condition, it can impact daily life in subtle ways, such as trouble choosing matching clothes or reading colored charts. Color blindness is not a form of actual blindness, but rather a deficiency in the way the eyes perceive colors. Understanding this condition is important for both those affected and those around them, as it can influence learning, work, and social interactions. Most common cause of color blindness is genetic, meaning it is inherited from one or both parents. This form is passed down through the X chromosome, which is why color blindness is much more common in males than females. If a mother carries the gene, her sons have a higher chance of being affected. Genetic color blindness is present from birth and usually remains stable throughout life. Understanding the hereditary nature of this condition can help families recognize it early and seek appropriate support, especially for children who may struggle with color-based tasks in school. Colorblindness can also be acquired later in life due to various factors. Eye diseases like glaucoma or macular degeneration, damage to the optic nerve, and even age-related changes can all affect color vision. Additionally, certain medications or exposure to chemicals may lead to color vision problems. Unlike genetic colorblindness, acquired forms may progress or change over time depending on the underlying cause. Recognizing these risk factors is important, especially for adults who notice changes in their color perception as they age or after starting new medications. Red-green color blindness is the most common type, affecting the ability to distinguish between red and green hues. There are two main subtypes, protanopia or protanomaly, which reduce sensitivity to red light, and deuteranopia or deuteranomaly, which reduce sensitivity to green light. People with this type may confuse reds with greens, making tasks like reading traffic lights or selecting ripe fruits more challenging. Despite these difficulties, many people adapt well and develop strategies to cope with everyday situations. Blue-yellow color blindness, also known as tritanopia or tritanomaly, is much less common than red-green types. People with this condition have difficulty distinguishing between blue and yellow hues. This can affect the ability to tell the difference between blue and green or yellow and violet. Everyday tasks like choosing clothing or interpreting color-coded information can become confusing. While rare, understanding this type is important for accurate diagnosis and support. Total color blindness or achromatopsia is extremely rare. People with this condition see no color at all, only shades of black, white, and gray. Achromatopsia can make the world appear much less vibrant and can also be associated with other vision problems, such as sensitivity to light and poor visual acuity. While most people with colorblindness have only partial deficiencies, total colorblindness presents unique challenges and often requires special adaptations for daily life. Symptoms of color blindness can vary, but common signs include difficulty distinguishing red from green or blue from yellow. Some people may struggle to identify colors in low light or may experience learning delays in childhood, such as confusing colors in class. Often, individuals are unaware of their condition until tested, as they may have adapted to their unique way of seeing the world. Early recognition of symptoms is key, especially for children, to ensure they receive the right support in educational settings. Diagnosing color blindness typically involves a few specialized tests. The Ishihara test is the most common, using colored dot patterns to reveal red-green deficiencies. For more precise analysis, an anomaloscope can be used, which measures how well a person can match different colors. The Farnsworth test asks individuals to sort colored caps by hue, helping to identify the type and severity of color vision deficiency. These tests are quick, painless, and essential for understanding the specific challenges a person may face. While there is no permanent cure for genetic color blindness, several tools and strategies can help people manage the condition. Special lenses or glasses such as Enchroma may enhance color perception for some users. Apps and digital tools are available to assist with color identification, making daily tasks easier. Education and career guidance are also important, helping individuals adjust to their limitations and find suitable paths. With the right support, people with color blindness can lead full and successful lives.